How much time do we got? Mr. Klein, I think we're quite low. President Obama, we got low time? Because I got all kinds of more stuff. Mr. Klein, well, it's your schedule. We're happy to keep you as long as you'd like. President Obama, well, there are a couple points I want to make in closing. Mr. Klein, excellent. President Obama, but why don't you ask some questions? Mr. Klein, so one thing we haven't touched on yet in much detail is the delivery system of Follow UPS. Which are a big part of the law. So what is a policy or experiment or change in that space that has overperformed your expectations? And what's one that has maybe not panned out as you'd liked or hoped? President Obama, you know, I think a good example of something that's worked better than we expected. Or at least worked as well as we expected is the issue of hospital readmissions. Now, it turns out that a lot of times you go to the hospital, let's say, you get your appendix taken out. And then you go home and then there's a complication, and then you have to go back into the hospital. That's obviously inconvenient for you and it's expensive for the system as a whole. And it turns out that there are just a few things that you can do that help reduce people being readmitted. First of all, making sure that the first procedure goes well. But, secondly, making sure that there's good follow-up. So it might be that a hospital or a healthcare system pays for, when you do go home. You just getting some phone calls to remind you to take the medicine that you got to take to make sure you heal properly because may have done a study and it turns out that people forget to do what they're supposed to do. They don't follow exactly their doctor's instructions, and they can't afford to have a nurse in their house who's doing it for them. Well, maybe there are just a few things that can be done to help make sure that they do what they are supposed to do. And that way they don't have complications. What we've seen is a significant reduction in hospital readmissions over the course of this law just by doing some smart incentivizing. Just saying to the hospitals we'll reimburse you or we'll give you some other benefit for doing smart follow-up. That's an area where I think we've made some real progress. The other place, and this is connected, where I think we've got some good bipartisan support, is just encouraging what's called shifting from what's called fee-for-service payments. Where you get paid by the procedure, which means that you may end up getting 5 tests instead of getting one test that's emailed to 5 providers who are treating you. And we've started to see some real movement when we say to the system as a whole we're going to pay you for outcomes. Did the patient do well? And that has been helpful. In terms of areas where I think we haven't seen as much improvement as I'd like, it's probably one thing that comes to mind is on the electronic medical records. If you think about how wired and plugged in everybody is now, I mean, you can basically do everything off your phone. The fact that there are still just mountains of paperwork. And you don't understand what these bills are that still get sent to your house, and nobody and the doctors still have to input stuff. And the nurses are spending all their time on all this administrative work we put a big slug of. Money into trying to encourage everybody to digitalize, catch up with the rest of the world here. And it's proven to be harder than we expected. Partly because everybody has different systems, they don't all talk to each other. It requires retraining people in how to use them effectively. And I'm optimistic that over time it's inevitable that it's going to get better. Because every other part of our lives, it's become paperless. But it's been a lot slower than I would have expected. And some of it has to do with the fact that, as I said, it's decentralized and everybody has different systems. In some cases, you have sort of economic incentives that are pushing against making the system work better. For example, there are service providers people make money on keeping people's medical records. So making it easier for everybody to access each other's. Medical records means that there are some folks who could lose business. And that has turned out to be a little more complicated than I expected. MS. Cliff, do you have any closing remarks? And one thing I'm interested in is kind of what you see your role in this debate we're gearing up for. President Obama, well, let me make a couple of closing remarks. Number 1, I think it is important to remember that just because people campaigned on repealing this law, it is a much more complicated process to repeal this law than I think. Was being presented on the campaign trail, as my Republican friends are discovering. The way this process is going to work, there's this rushed vote that's taking place this week. Next week to quote, unquote repeal Obamacare. But really all that is it's a resolution that is then instructing these committees in Congress. To start actually drafting a law that specifically would say what's being repealed and what's not. Then, after that, they'd have to make a decision about what's going to replace it and how long is that going to take. And that stretches the process out further. And so I think, whether you originally supported Obamacare or you didn't, whether you like me or you don't, the one thing I would just ask all the American people to do is adopt the slogan of the great state of Missouri, show me. And to Republicans, I would say, what are you scared of? If you are absolutely convinced, as you have been adamant about for the last 7 years, that you can come up with something better, go ahead and come up with it. And I'll even cut you some slack for the fact that you've been saying you can come up. With something better for 7 years and I've never seen it. But we'll restart the clock. It's interesting that we're here in the Blair House because this is a place where I met in front of the American people, with Republicans who had already indicated their adamant opposition to health care. And I sat with them for a couple hours. How long was it? Secretary Sebelius, 8. President Obama, 8 hours. Kathleen Sebelius, who is my Secretary of Health and Human Services, remembers for 8 hours. On live TV, to talk about here's why we're trying to do what we're doing here. And challenging them to come up with better answers than the ones we had come up with. And we spent a year of really significant debate. And I would think that given that we now have proof that 20 million people do have health insurance, that we're at the lowest rate of uninsured in our history, that healthcare costs, rather than spiking way up, have actually gone up slower than they have in 50 years, given that the vast majority of people who get health insurance through Obamacare have said they're satisfied with their care and that they're better off than when they didn't have care. Given that even though a lot of people don't know it, even if you're not getting health insurance through Obamacare, you've benefited, because if you get health insurance on the job, it now doesn't have a lifetime limit. It doesn't have fine print that could end up costing you a lot of money given all those things. I would think that you'd at least want to explain to the American people what it is that you want to do. And that, I think, is a minimum expectation out of this Congress and out of the president-elect. I make a second point, and that is that we just worked, on a bipartisan basis. To sign something called the Cures Bill that included two really important bipartisan priorities. One was Joe Biden's Cancer Moonshot Initiative because we're seeing so many medical breakthroughs. in so many areas that we have an opportunity to make a real dent in how we deal with cancer. Which affects everybody in some fashion. Somebody has been touched in your family with this terrible disease. So we got a lot more money for research in that. And the bill also contained a big investment in the opioid challenge. As many of you know, you're seeing more and more communities that are being ravaged by initially, prescription drugs, then that ends up being a gateway into heroin, some of which like synthetic heroin being produced called fentanyl, just has terrible rates of overdose deaths. And this is not an inner city problem, per se, but this is reaching every community. In some ways, it's worse in a lot of rural communities. So there was a bipartisan effort for us to put some more money into that. But here's the thing. If we just put money into cancer research, and we just put money into dealing with the opioid crisis, and now we're taking away money that is providing drug treatment. Services in those very same communities by repealing Obamacare. And taking away the ability to access a doctor to get new cancer treatments, then we're not really helping anybody. So that's a second point I want to make. A third point I want to make is that I would encourage local communities to get involved in this process. And I think part of the problem with this whole law has been that the people who benefit aren't out there making noise. And the people who ideologically have opposed it have been really loud. Well, now is the time for people who have benefited or seen their families benefit to tell their stories.